welcome back with Talk with Terry Tuesday. We're glad to have you join us again. We've been doing this weekly so that you guys have information that otherwise you may not know is even available to you. So today we are I'm surrounded by all these lovely devices. We're actually going to talk about vaginal rejuvenation. So, what is vaginal rejuvenation? Most people think that when you're you can do vaginal rejuvenation a couple of ways. You can actually do surgical vaginal rejuvenation where you're tightening up everything. People generally do this when they've had children and they're done having children, so they wanted to kind of go back before kids. So that's one reason that people do it. A lot of people will do it because they have bladder concerns. So if they cough, or they sneeze, or they're running and they're leaking urine, that's another reason why people will do the vaginal rejuvenation. So there are multiple reasons why people have vaginal rejuvenation, and what we're going to do today is kind of talk about why they're doing it and what we do here, what your other options are, and then we'll go from there. I'm actually going to start off because someone actually they sent in a question earlier regarding using the surgical procedure called a sling. And what a sling is that it is a piece of material that we actually insert surgically so that when you cough or sneeze, it actually kinks the urethra so that you don't leak urine. So someone wanted to know, is it the same as what we do? The question is sort of, but not really. And we'll get into all of that as to why. So let's start off with vaginal rejuvenation. There are different types of vaginal rejuvenation. There is surgical, there is laser, there is radio frequency. I tend to do the radio frequency on both of these devices. This is called Thermiva, and this is called Ultrafilm. This is a BTL Exilis. They both are radio frequency procedures. What are some reasons why you can't do this procedure? If you have metal in the pelvic area, so if you have issue, which is a tubal ligation where there's metal coils that are put in your tube, if you have a copper IUD, if you have the Mirena IUD or the hormonal IUD, that's completely fine. But if you have the copper IUD, that's a metal. You cannot do radio frequency with those devices. If you had your tubes tied, they put clips that are metal on your tubes. You don't want to do anything that has metal in the pelvic area or in the abdominal area because this can cause discomfort from the radio frequency. Now, what is it? So Thermiva was the one that actually came out first. This is the handpiece that we use for the Thermiva. This area here is where the radio frequency actually comes out. This procedure for the Thermiva actually takes about 35-40 minutes to do. The reason why it takes that length of time is because I have to do each individual section in the vagina. So I may start with the left side up the top, then I'll do the middle, so each side we have to do specifically to reach those areas. So then along came another device that is still radio frequency, but this takes a shorter amount of time with a little higher frequency, and I can control the temperature of the radio frequency devices. But this is the Ultrafilm. So this has 360 degrees of radio frequency. So when we're inserting this, it's actually heating the tissue and building the collagen. This is what I use on the outside. So you can see this whole tip is radio frequency. Now, what does radio frequency do? We can do radio frequency anywhere on the body. It helps to tighten the skin, so it will tighten the tissue. It helps with elasticity, so that the tissue is not, it's more elastic, so it actually helps it move freer. Helps increase vascularization, helps with nerve function. So I would tell you that when people talk about vaginal rejuvenation, it's more than just improving intercourse. It's more than just tightening the tissue. Probably about 70 to 75% of my clients who do this do it because they are having bladder issues. So, which brings us back to the sling. So, what it does with the bladder, the bladder sits right on top of the vagina. So, it also helps to rebuild that tissue. So, once again, helps rebuilding collagen, helps with elasticity, helps improve the vascularity to the area, helps with also, like I said, the nerve function. So, people who may have urinary urgency, people who have leaking if they cough or sneeze. Those are things that will actually help improve those symptoms with radio frequency. Getting back to the surgical procedure, because this is something that is listed as vaginal rejuvenation, it's considered cosmetic. So insurance does not cover it. The plus is that there's no downtime with this. So you have the procedure done, you leave here. If you want to have intercourse that night, you can. Some other procedures you can't. So laser, can't have intercourse that night. You have to give it a couple days before you can do any type of vaginal insertion. But for radio frequency, once again, you go on with your day. As soon as you leave here, you'll see improvement in moisture. You'll see improvement in urinary symptoms. You will, a lot of times we will focus on the top part of the vagina where there's a nerve bundle, which actually helps to stimulate the nerve function. So you may have improvement in intercourse and orgasms. And it also helps when sometimes after having kids, the tissue starts to drop a little bit. So it helps to actually tighten that as well. How often do you have to do it? Initially, we have you do 3 treatments. So sometimes we'll do, with this one, we have you do it every 2 weeks. With the Thermiva, we have you do them between 3 to 4 weeks apart. The Thermiva procedure takes about 40 minutes. Once again, the ultrafilm takes about 20 minutes. So, and there is a price difference between the two, and it's just because of the actual devices and the probes that we actually have to purchase for this. How often do you have to do it? None of this is permanent. So usually what people do is that they do the initial first 3 treatments, and then you may not have to do it again for 6 months to a year. But when you come in to do more of a maintenance, you only do 1 treatment. You don't have to do the whole 3 treatments. Now, if you wait 3 to 4 years, you probably have to do the whole treatment again because we have to rebuild back up that collagen, the nerve bundle, so all of that. But once again, like I said, probably about 75–80% of my clients do it for bladder issue. Now, they also do it for people who have a lot of vaginal dryness and they can't take hormones, and intercourse is painful. It does improve those symptoms because, once again, it's increasing vascularity, it's increasing the nerve function to that area. So people who are having a lot of vaginal dryness, vaginal pain with intercourse, I may use this one because it's a smaller probe, so it's less uncomfortable when you're doing the procedure versus inserting this. This you may not like if you are having pain with intercourse, so I probably wouldn't use this one for someone who's coming in for that procedure. There are some people who also have noticed significant improvements in their vaginal pH balance. So people can get recurrent, what's called bacterial vaginosis, where you keep having this discharge. And it's because your pH balance can be off. There are things that you can take over the counter, but this also helps to change and improve your vaginal pH. Because as we get older, our hormones start to change, and so all of those things can be off. But this helps with that as well. Anyone who's had kids, or just as we get older, Kegels, you should be doing. And how do you do Kegels? What are Kegels? These are things that you can do on your own. You can do at home, you can do in the grocery store. You're just squeezing the vaginal muscles so that it's making the muscle stronger. Like any other muscle, if you don't do exercising for it, it will become weaker. So when you cough or sneeze, your muscles don't contract as well and you'll leak. So this is what vaginal rejuvenation is. But once again, for someone to ask a question about the surgical procedure, the sling, definitely I encourage people to do your Kegels, especially after you have a baby. And it just helps to improve that muscle tone in the vaginal area. But if you're having bladder leaking, if you're having vaginal dryness, if you just want to have a touch-up of the vagina because you've had some kids, or as you get older, things become a little bit more laxed, these are other options. Surgery is an option as well, but you're going to have downtime with surgery. And you're going to have recovery time with that. So just other options, other reasons that you are aware of, that if you don't want surgery, or you're having those symptoms, or you don't want the downtime, this is another alternative. I don't know if anyone has kind of asked any questions in between, but if you have questions, if you have concerns, definitely give us a call. We can always do a virtual consultation. You do need to have a pap smear if you're having any type of vaginal rejuvenation procedure. And that's just to keep things up to date. But vaginal rejuvenation, it's something that we do. Once again, this takes 20 minutes. This takes about 40 minutes. But if you have questions or you want to do a consultation, just give us a call. We'll set up a virtual, or you can come in. So the phone number, 708-864-4988. Like us on Facebook. What's the other one on
Follow
Instagram?
Follow us on
Instagram.
Twitter. Subscribe on YouTube.
Yes, and we are going to start doing podcasts, so you'll be able to also see us on podcasts. We'll be everywhere. So any information that you need, we're trying to make it accessible to you, so that if you have questions about some of these things, now you know what your options are. But thank you again for joining us on Talk with Terry Tuesday. We're going to do this for the next couple of Tuesdays until the end of August. Then starting in September, we'll probably go back to doing it once a month. But thank you for joining us. We'll talk to you soon. Bye.